JOSIE DUGGAR'S seizure scare sparks emotional response from entire family. Reports confirm that JOSIE DUGGAR recently experienced a seizure episode, prompting immediate concern and intervention from her family. According to sources close to the Duggar household, the incident occurred unexpectedly, causing a swift response from both parents and other immediate family members. Observers note that seizures in children can be alarming, often requiring rapid assessment and medical evaluation to determine underlying causes and ensure the child's safety. Hospital insiders indicate that JOSIE was promptly attended to by healthcare professionals, who conducted initial assessments to stabilize her condition. Reports suggest that the medical team closely monitored vital signs, administered appropriate interventions, and performed diagnostic tests to evaluate the severity and potential triggers of the seizure. Observers note that early intervention in seizure episodes is critical for preventing complications and ensuring overall health and safety. Family sources confirm that JOSIE's parents were immediately notified and present during the emergency response. Observers report that the Duggar family acted with urgency and composure, prioritizing her care while coordinating with medical staff. Emotional responses ranged from alarm to relief as they witnessed her being stabilized and assessed. Experts emphasize that family involvement during pediatric emergencies is vital for both practical assistance and emotional support. According to hospital reports, JOSIE underwent a series of diagnostic evaluations, including neurological assessments, blood work, and imaging where necessary. These procedures aim to identify potential causes of seizure activity, such as electrolyte imbalances, infections, or neurological conditions. Observers stress that thorough evaluation is essential in determining both immediate treatment needs and long-term management plans for seizure disorders. Sources indicate that JOSIE DUGGAR'S medical team maintained continuous monitoring following the episode to ensure stability. Reports suggest that observation included regular checks of vital signs, assessment of consciousness, and evaluation for any recurrence of seizure activity. Experts note that post-seizure monitoring is a standard practice in pediatric care to confirm that the child has returned to baseline and to identify any emergent complications. Family insiders confirm that the Duggar household responded with coordinated efforts to provide both emotional and practical support. Observers note that family members assisted in transportation to the hospital, coordination with healthcare providers, and provision of comfort and reassurance for JOSIE during this stressful period. Mental health professionals highlight that such structured support is critical in managing anxiety and promoting recovery in children following medical emergencies. Reports indicate that the medical evaluation ruled out immediate life-threatening conditions, and JOSIE's condition was stabilized under professional care. Sources emphasize that while the incident was alarming, the prompt response and medical attention contributed to a positive outcome. Observers note that rapid intervention is often a decisive factor in preventing complications associated with seizure episodes. According to hospital insiders, JOSIE underwent further neurological testing to understand potential triggers and evaluate the risk of future seizures. Tests reportedly included electroencephalogram, EEG, monitoring, neurological exams, and consultations with pediatric neurology specialists. Observers emphasize that comprehensive evaluation is essential in determining appropriate treatment plans, including potential medication management, lifestyle adjustments, or further diagnostic investigations. Family sources report that the emotional impact of the seizure episode was significant, with parents and siblings experiencing heightened concern. Observers note that witnessing a child experience a seizure can be distressing, often eliciting intense emotional responses, including anxiety, fear, and vigilance. Experts highlight that structured emotional support for the family is essential in managing stress and promoting resilience following medical emergencies. Reports confirm that JOSIE DUGGAR received continuous care during the post-episode period, including monitoring for potential aftereffects, ensuring adequate hydration and nutrition, and assessing neurological responses. Observers note that this period of observation is critical for preventing complications and providing reassurance to both child and family. Hospital insiders indicate that the medical team has recommended follow-up appointments to monitor Josie's neurological health and ensure that any underlying conditions are addressed. Sources suggest that ongoing monitoring may include additional EEG testing, consultations with pediatric neurologists, and evaluation of any triggers identified during the initial episode. Observers emphasize that structured follow-up is essential for managing seizure risk and promoting long-term health outcomes. Family sources report that the Duggar household has implemented precautionary measures at home, including increased supervision, guidance on recognizing seizure signs, and readiness to respond to potential episodes. Observers highlight that such preparedness is crucial in managing pediatric seizure disorders and ensuring both safety and peace of mind for the family. Reports suggest that Josie Duggar's seizure episode has sparked a broader awareness among family members regarding neurological health, emergency response, and child safety protocols. Sources indicate that family members have sought advice from medical professionals on preventive strategies and appropriate responses, emphasizing proactive measures to protect Josie's well-being. Hospital insiders note that Josie responded well to initial care, with stabilization achieved within a short period. Reports indicate that her vital signs returned to baseline. Neurological function was evaluated as normal post-episode, and she was deemed stable for discharge with continued outpatient monitoring. Observers emphasize that prompt, coordinated medical care is often the determinant factor in favorable outcomes following pediatric seizures. Family sources confirm that emotional support continues to be a priority, with siblings and parents providing reassurance, comfort, and stability. Observers note that the psychological impact of medical emergencies on children and families can be significant, and structured support mechanisms are critical in mitigating stress, anxiety, and potential behavioral effects. Reports indicate that Josie Duggar will continue to be closely monitored by her medical team, with attention to potential triggers, recurrence of episodes, and overall neurological development. Observers emphasize that ongoing evaluation allows for timely intervention, adjustment of care plans, and proactive management of risk factors. Hospital insiders suggest that Josie's episode has underscored the importance of rapid response, family coordination, and medical preparedness in pediatric emergencies. Sources note that timely assessment, stabilization, and diagnostic evaluation are central to reducing risks and ensuring positive outcomes for children experiencing seizures. Family members reportedly remain vigilant, maintaining communication with healthcare providers and implementing home precautions to support Josie's health and safety. Observers highlight that such structured approaches help prevent complications, provide reassurance, and enhance confidence in managing potential future episodes. Reports confirm that Josie Duggar's condition is currently stable, with medical professionals continuing to monitor neurological status, vital signs, and overall health. Observers note that continuous observation, structured care, and family involvement are critical in post-seizure recovery and ongoing management. Hospital sources indicate that precautionary measures and follow-up care plans have been established to support Josie Duggar, including potential medication assessment, lifestyle recommendations, and scheduled neurological evaluations. Experts emphasize that comprehensive management plans are essential in ensuring long-term health and minimizing risks associated with seizure disorders. Family insiders report that emotional recovery and reassurance are ongoing priorities, with attention to both Josie's well-being and the family's collective response. Observers note that structured support, guidance, and preparedness contribute to resilience and effective coping following pediatric emergencies. Reports suggest that the Duggar family has coordinated with healthcare professionals to establish emergency response protocols at home, ensuring rapid intervention should another seizure occur. Observers emphasize that preparedness, combined with professional oversight, is a key factor in maintaining safety and confidence in managing seizure risk. Hospital insiders confirmed that JOSIE's medical evaluations included assessment for potential underlying conditions, evaluation of triggers, and implementation of individualized monitoring strategies. Sources indicate that comprehensive evaluation is critical to formulating an effective care plan and mitigating the risk of recurrent episodes. Family sources note that JOSIE DUGGAR'S emotional and physical well-being remains the central focus, with ongoing support, structured routines, and medical guidance forming the basis of post-episode care. Observers emphasize that balancing vigilance with reassurance is essential in promoting recovery, confidence, and stability in pediatric patients and their families. Reports indicate that JOSIE DUGGAR has been observed for any residual effects following the seizure, with medical staff confirming that she demonstrates normal neurological function post-episode. Experts highlight that careful observation post-seizure is a critical component of pediatric care, ensuring early detection of complications and providing reassurance to caregivers. Hospital insiders report that JOSIE's family has been actively involved in consultations with medical professionals, reinforcing the importance of structured support, adherence to recommended care plans, and preparation for potential future episodes. Observers emphasize that family engagement is crucial in supporting children with seizure disorders and ensuring adherence to medical guidance. Sources confirm that JOSIE DUGGAR'S care plan includes continued monitoring, follow-up appointments, and preventive strategies to mitigate seizure risk. Observers note that proactive management, structured intervention, and family involvement collectively contribute to positive outcomes in pediatric seizure management. Reports indicate that JOSIE DUGGAR'S seizure incident has prompted heightened awareness of neurological health, emergency response preparedness, and the importance of coordinated family and medical support. Experts stress that timely intervention, structured monitoring, and comprehensive support systems are critical in mitigating risks and promoting long-term well-being. Family sources confirm that emotional and logistical support remains central, with parents and siblings actively participating in care routines, ensuring adherence to medical recommendations, and providing reassurance. Observers note that such engagement is fundamental in fostering stability, resilience, and confidence in managing health challenges. Hospital insiders report that ongoing follow-up evaluations will focus on neurological assessments, potential triggers, and preventive strategies to reduce the likelihood of recurrence. Experts emphasize that continuous monitoring and proactive care are central to the effective management of pediatric seizure disorders. Sources indicate that JOSIE DUGGAR'S family is balancing attention to her medical needs with emotional support, privacy, and daily routines. Observers highlight that such a holistic approach is critical in promoting both recovery and long-term well-being. Reports confirm that JOSIE's condition is stable, with structured monitoring and support ensuring her safety and health. Hospital sources emphasized that adherence to medical guidance, ongoing surveillance, and coordinated family support are essential components of effective pediatric seizure management. Family and hospital insiders indicate that JOSIE DUGGAR continues to receive attentive care, emotional reassurance, and structured oversight. Observers stress that prompt intervention, medical monitoring, and family involvement collectively ensure optimal outcomes for children experiencing seizure episodes. The Duggar family reportedly remains committed to maintaining a safe, supportive, and responsive environment for JOSIE, emphasizing both vigilance and reassurance. Experts highlight that structured care, medical oversight, and emotional support are essential in promoting recovery, stability, and resilience following pediatric seizure incidents. Thanks for watching.